So you've been training jiu-jitsu for 1, 2, 3 years or more. It's likely at some point you come across some kind of mat infection. Now I myself have had many of these over the past couple of years, so I understand the challenges of trying to get rid of the infection just so you can get back on the mat to train again. So what are mat infections? Can we prevent them? And what do we do once we get them? We're going to go through all in this video, so stick around to the end. So according to a recent review on the subject, the 3 most common types of infections in combat sports are staph infection, ringworm, and then a variation of herpes. Now typically, staph will come up as sort of 1 or more sores, can be very painful, and it'll show quite a lot of redness around the skin. So ringworm, as the name suggests, actually comes up in sort of like little rings. Typically it's quite red around the area, usually a little bit of dry skin and very, very itchy. And again, this can be found on the surface of the skin, can be found in the hair or even in the beard, which makes it even worse and harder to get rid of. And then finally, herpes gladiatorum, probably butchered the pronunciation there, is also a pretty common infection. Now again, this can come up as 1 or more blisters that can sort of cluster together on the surface of the skin. And this can be accompanied with sort of clear fluid. I have also drew a few pictures here just to give you an idea of sort of what they look like. But as you can see, I'm no artist, so I'll put some pictures on the screen for you guys to see. Okay, so what about risk occurrence? How often are these types of infections actually coming up in contact sports? So according to that recent review, one of the most popular types of infection amongst freestyle wrestlers, both at the high school and collegiate level, was herpes, with 30% prevalence amongst wrestlers. Now closely following that, we see in jiu-jitsu athletes that ringworm's one of the most popular, with around 10 to 25% prevalence. Now again, this maybe isn't too surprising, as ringworm tends to be a little bit more common, especially on very sweaty mats, or if you've got a gym space, it's pretty enclosed in with very little ventilation. We'll talk about some of the risk factors in just a second. And finally, staph infection ranges from around 5 to 15% or more occurrence in grappling sports. Okay, so what are the risk factors? Well, we've got 3 key risk factors here. We've got the athlete, the environment, and then social factors. So if we break these down one by one, for the athlete, things like cuts, abrasions, mat burn, they're going to significantly increase our risk of getting some kind of mat infection. If we have got cuts, and maybe we've already been infected, we also increase our chances of transmitting that onto someone else, especially when skin contact is a pretty common thing in jiu-jitsu. So of course, personal hygiene, a pretty basic one. If we're not clean, if we're not making sure that we're showering after we finish training, then that's going to really skyrocket our chances of getting some kind of infection. Leaving the bacteria and all the crap off the mat on your skin is definitely a fast track way of getting these nasty things. Increased physical contacts. So if you're training 6 times a week, 2 a day, the amount of contacts that you're actually obtaining within a week is pretty substantial. So again, it's going to increase our risk of transmitting and catching these infections, especially as a lot of the types of infections such as ringworm can actually be transmitted through skin contact. And then finally for the athlete, we can see suppressed immune system. So if we've got poor immune function, then this again is going to increase our chances of mat infections and all other kind of infections. Now if we look at environmental factors, this is primarily related to the gym and the mat space. So again, poor mat maintenance is the first one. So mats that are never cleaned after training, they may have loads of cuts and damage to the mat, which again allows bacteria to build up, is going to increase those chances. So contaminated changing rooms and showers. Again, if we're getting changed and showered in a very dirty environment or somewhere where it's not very clean, this may increase our chances, especially if the surfaces haven't been cleaned down properly. Poor ventilation. So if you're in a gym that doesn't have any sort of windows, doors, shutters, or an actual ventilation system, then again, it's going to become pretty humid, especially when we're looking at the weather at the moment, where it's like, 25, 30 degrees plus. It gets very hot and sweaty, and again, allows for bacteria to build up. Finally, for environmental, we can look at overcrowding. So if we're using a mat space that's pretty small and there's loads of bodies on the mat, again, could be a pretty decent risk factor. And then finally, when we look at the social side of things, this is where it becomes a little bit interesting. So we're looking here mainly at things like education and awareness. So a lack of education around mat infections, but also personal hygiene. So this can lead us to actually neglecting a lot of these things if we don't really have self-awareness for what these are. Also understanding what these types of infections look like, what the common symptoms are, can again lead us to actually training with them and not realising. And then finally on this, actually having a screening process. Now, rather than this actually being a risk factor, this is something that can actually be used as a control measure. So in the study that we've been referencing, they actually recommend athletes have regular screening from medical experts. Now again, for most people that are watching this video, they're probably hobbyist jiu-jitsu practitioners, this may not be as relevant. However, what we can do is make sure that we're keeping an eye out for any cuts, abrasions, mat burn, making sure that we cover those up, and then keeping an eye out after sessions to see the condition of the skin, to make sure there's no red lumps, to make sure there's no sort of itchiness to the skin, which again are some potential symptoms of some of the infections we discussed. Okay, so first thing we're going to tackle here is prevention. Can we truly prevent infections? Now, pretty straightforward answer here, no, we can't. We can't prevent infections the same way that we can't actually truly prevent injuries. However, we can reduce our chances and likelihood of infections or injuries. So how can we do this? Well, there's three main ways that we can do this. So we've got number one, screening. We've got personal hygiene and team hygiene. And finally, we've got pharmacological and non-pharmacological intervention. So to go through each one of these, screening. So routine screening on a daily basis before and after training to make sure our skin is in good condition, there's no cuts, abrasions or infections. Generally inspecting the area is a pretty good idea. Now personal team hygiene, again this is a pretty straightforward one, making sure that we're showering directly after training. Consider using some kind of antimicrobial or antifungal cleansers may be a really good idea. And of course making sure that our actual training gear such as our rash guards or gis are nice and clean. And also, as part of the team, making sure the mat space is clean too. When we look at pharmacological and non-pharmacological intervention, the evidence currently is pretty limited on these. However, we can consider using things like antiviral prophylaxis to reduce the recurrence of more of the viral-based infections such as herpes. We've then got our topical creams such as our antifungal creams, which again, these can be actually applied to the skin to help to reduce transmission and likelihood of infection. So things like clotrimazole or terbinafine might actually be really useful here. What we should consider is that using anything that's sort of antibiotic or anything like that may actually reduce the effectiveness of the cream or medication due to building up a little bit of a resistance to them. Instead, you might want to consider non-pharmacological interventions. Though the research and literature is pretty limited on these, we can use things like petroleum jelly and other ointments to actually reduce the chance of infection by applying these to any sort of cuts or wounds. And this sort of feeds back into the personal hygiene where we're actually making sure that we're doing proper wound care when we need to. Okay, now return to sport guidelines are going to be very specific to the sport, but rough guidelines from the authors suggest if we've got open draining staph, we want to make sure that we're excluded until 24 hours of taking antibiotics. With also no drainage, so the wound shouldn't be weeping, as again this is going to be a key risk factor to transmitting the infection. If we've got pretty bad ringworm, we want to make sure that we're applying some kind of topical cream or systemic if we're using some kind of oral medication to get rid of the infection. And this should be done for at least 72 hours before returning back to the mat. And then finally, if we've got herpes gladiatorum, we want to exclude until 120 hours of antiviral. There should be no new lesions. These are just some general recommendations for timelines and when we should actually look at returning back to the sport. Again, the specifics of when we do get back on the mat should be dictated by the infection and getting that cleared up with actual medical professionals. So again, these rough guidelines just give you an idea, but always seek help. And then also a conversation with your coach as to when it's actually safe to return is always worth doing. So overall guys, making sure you keep yourself clean, keep educated on what these infections look like. And if you do get them, don't be a bad training partner and keep on rolling when you know you're infected. Get it checked, get it cleared up and return back to the mat. As always guys, make sure you like, comment, share and save.